Welcome to CARE. My name is Andrea Menifee, and I'm CARE's Director of Nutrition based in Washington, D.C. I'm so excited that you've joined us, and I'm also so happy to be able to share our work with you. Let's talk about nutrition and why it is at the center of CARE's food and water systems work. Optimal nutrition supports healthy mothers and babies and optimal growth and development in children. Optimal nutrition is a catalyst for improving students' ability to concentrate and learn in school so that they have better opportunities later in life. Good nutrition also supports the productive capacity and employment for women and men because healthy and well-nourished people are better equipped to work and produce. Because of this, nutrition is a key factor in a country's economic growth. Did you know that every dollar spent on funding nutrition generates $16 in returns? Our donors know this, and they know that investing in nutrition is a smart economic investment because of the return: better health, education, productivity, income, and stability, and prosperous futures. I'd like to share a few basic terms that we use in our work. Wasting is thinness caused by not enough food and/or illness that results in sudden weight loss. This is what we think of when we talk about malnutrition, but there are other kinds. Chronic malnutrition is shortness in children compared to their peers. The most common form of malnutrition is stunting, chronic malnutrition, and it's irreversible after 2 years of age. Micronutrient malnutrition is when a person or child is not eating or supplementing enough essential nutrients to grow and stay healthy. Nutrition-specific interventions address the immediate cause of malnutrition, and nutrition-sensitive interventions influence the underlying causes of malnutrition. Advocacy to government and global and national motivation to address malnutrition through global movements and country policies and plans is a big part of our work. CARE USA is the global lead for nutrition for all CARE members and countries. That means that members and country teams can look to our nutrition team for support on projects, project design, proposals, and in-person and remote technical support. CARE's Right to Food and Water and Nutrition Impact Area strategy ensures that all of our programs include objectives for improved nutrition, especially for women and children during the critical 1,000 days window from conception to a child's second birthday. This is the time when good nutrition has the biggest impact. We bring together relevant sectors to address the direct and root causes of and barriers to better nutrition, such as access to nutritious foods in markets and through improved agriculture, livelihoods and income, improved health and nutrition services, sanitation and hygiene, education, and women's empowerment. Our nutrition work actively advocates for national policies and plans to improve nutrition for women and children. Our impact is measured not only by what nutritious foods people can grow, eat, and feed their children, but in actual physical measurements of children that tell us if they are growing well and are not stunted. CARE's impact data from 2015 to 2020 shows that nearly 1,400,000 children escaped stunting in 28 countries due to CARE's work. Our work in nutrition focuses on 4 main themes that are directly linked to CARE's Women at the Center Food and Water System strategy. Social behavior change and communication to promote positive nutrition practices and shift harmful norms related to nutrition is a big part of our work. Our nutrition-specific interventions addressed the direct causes to improve nutrition, such as infant and young child feeding practices, adolescent and maternal nutrition, micronutrient sufficiency, and access to health services and non-communicable disease prevention. Nutrition-sensitive agriculture, or homestead food production, empowers women and girls to decide what to grow, what to keep, and what to use for improved, diverse, and healthy diets. Our multi-sectoral nutrition sensitive interventions support core nutrition specific and behavior-based approaches so that we not only promote improved practices, but also build an enabling environment for adopting them. Of course, optimal nutrition always depends on good hygiene and sanitation. Finally, we work with inclusive community food and market systems, health and nutrition systems, and government systems to sustain improvements in nutrition. This is a list of the programs and the types of programs that we work on, and this gives you an idea of the breadth and depth of our nutrition work, from multi-sectoral nutrition sensitive programs to food fortification for national policy. CARE's flagship nutrition program is a great example of how we work directly with communities, partners, and government counterparts to improve nutrition. CI4N works with partner institutions on the ground and government counterparts to collectively address causes of stunting and create large-scale sustained results. This approach enables us to support traditional project activities by convening and coordinating partners for joint implementation of this approach. CI4N in Bangladesh reduced stunting in children from 36% to 28% and wasting from 14% to 8%. This successful model is now a part of the official policy of the government of Bangladesh for the next decade for the health and nutrition sector. As you all are aware, many countries will be facing severe food insecurity as a result of climate change, drought, conflict, and failing supply chains. We will continue our work to improve nutrition in communities and countries around the world. We additionally will support humanitarian assistance to prevent women, children, and families in countries where severe malnutrition rates are highest from slipping into possible famine, and to build resiliency now to mitigate this crisis. I'm sharing a list of key documents that I think would be of interest. And of course, we're more than happy to meet and share our programming with you in more detail. So please feel free to contact us. Thank you so much, and all the best to you on your journey with CARE.